It was a really busy time in the hospital. We were under a lot of pressure. It was winter. Higher admissions into the hospital, higher attendances through A&E.
NHS usually in the month of winter is quite a busy, challenging environment. ED especially, it's hectic, it's crowded, overcrowded sometimes.
The bed position was quite challenged and we were planning for an activity level that would take us through a normal spring.
So I think to start off with, I heard about it in the news or sort of outside of work.
Saw it on the news, like when it was in China, and you're watching it and you think, oh, it's not really going to come over here.
We started hearing it more and more into Europe and hearing about Italy.
A number of us follow nationally quite a few of the societies on Twitter, and we saw some of the horrific information that was coming out of Spain and Italy at the time.
They were getting really high numbers in London, and then that's when I thought, well, yeah, we're definitely going to start seeing cases here.
Late February, beginning of March, the planning in earnest really started to happen.
So we were instructed to set up our own incident management room, which we did. We took over the MRI room on the main corridor.
Our matron on here had begun doing some preemptive work so that we could get ourselves prepared and get ourselves in a good place.
We had to then put posters up in the hospital to say, please inform us if you have been to China.
We were looking at how we were going to increase ventilator capacity across the organisation.
But it was during March we had our first positive case in the hospital.
I was a young patient which was treated at home. I came to A&E just briefly for a bit of a support and reassurance, and it was quite a shock for the family and for all of us to say that that's the moment where news is becoming a reality.
Immediate challenges around the virus were making sure that we had appropriate wards set up to deal with patients who tested positive for the virus.
The front door pressure point was going to be a particularly vulnerable area for any organisation.
Accident and emergency was one of the biggest areas that we had to change. So we created a red and a green pathway. Red being COVID positive or COVID suspected patients, green being those patients that we thought would not be COVID positive.
So we've already got a very established intensive care here, but we knew that we'd need an increase in beds.
So within a matter of weeks, we created a second ITU in a vacant ward area.
The organisation came to the decision to move the paediatric area out of its current location and into our paediatric outpatient area. Time was of the essence, and we completed that entire move over the weekend. The estates team did a fantastic job alongside the nurses and the doctors to make a really fit-for-purpose paediatric A&E, which is actually much improved over the space that we had in our main A&E.
So the estates team had to really mobilise into action to do a lot of work in a very, very short space of time, and they did a phenomenal job.
I think to begin with, when this all started, it was very much an adrenaline-based response. It was constant. You even when you went home at night, you were still thinking about things. The whole team instantly had their roles change overnight.
I used to tell my team at that point in time, come to work like it's the first day that you are coming into this hospital. That was the best way to describe it, because yesterday we made 10 changes that were put into practice today.
Rules and protocols and guidelines changed every day, and that was hard to keep up with.
Once the national pandemic was declared, all non-urgent operations were stopped. The staff were needed in other areas across the trust.
The staff were then moved every day around the trust in different places. So for the staff point of view, not only were they in a different speciality to their normal, but they were also quite understandably scared of COVID as well.
Endoscopy staff went and helped in the emergency department. Ophthalmology staff were redeployed across the organisation, and the ophthalmology team have actually been recognised nationally. They've been given an Cavell Award for their services.
I was redeployed at the start of COVID into ICU, which can look a little bit scary when you've worked in different areas and it's all new. Obviously in the mind you've got the seriousness of COVID and the fact that people are critically ill. So a huge responsibility.
Normal day-to-day working for the whole team was very hard, and especially for the nurses because nursing is very labour intensive, and we had a lot of patients who had to be turned onto their front to manage them. That would take about 5 staff to do that. So you can imagine when you have 15 patients in the whole unit, it's both physical and mental, the hard work that they had to go through.
We had staff members who were going off with the virus or family members who were going off with the virus, and then they had to take the appropriate precautions and time off work to do that. So we started to see absence levels rising, and they were very challenging times.
Quite early on, there was a lot of speed, there was a lot of pace, there was a lot of anxiety. So in amongst all that anxiety, we wanted to create a space that was calm, that allowed people to sit, have a cup of coffee, have a biscuit, have a chat. So that's really where the We Care Cafe was born.
The Open Office opened at the end of April, and it was in response to staff wellbeing needs. This was a former police community hub, so it was absolutely transformed by our estates team in a matter of days. And this is a space where staff can 7 days a week come and offload and have a chat.
We have tried to support staff through having appropriate PPE, and the procurement team did a fantastic job.
We are going through around about 11,000 surgical masks a day. We use about 10,000, 11,000 aprons a day, 50,000 pairs of gloves. I mean, without the team that we've got here, we would never have survived. They've worked solidly. We were working 24/7 on call. One of our mottos here really is we need to do everything we can to enable the frontline staff to do their jobs. During this period, it's even more so because obviously it's keeping them safe.
The people that came to support us from other departments are just absolutely outstanding, just stepped up to the mark and were just absolutely brilliant.
I wouldn't necessarily say I was scared, but it's the first time you realise that you're doing something where potentially you're risking your life to come to work.
The darkest hour of COVID, for me it was that Easter weekend, because we had escalated in terms of the level of pressure in our intensive care unit.
We suddenly had an influx of very, very acutely ill and unwell patients, probably the sickest that we've looked after and many of us experienced in our career, and we had a lot of them.
April last year on our ward we had 8 deaths, and then we averaged just over 1 a day in April, so it was significantly much worse.
It is always difficult, when you don't have any treatment and you see patients dying in front of your eyes, and also telling them, there's not a lot you could do. So that bit is always distressing.
I did notice, I think after the peak, staff were particularly tired and exhausted, and were showing signs that this had had quite an emotional toll on them.
A lot of our staff, they would deal with a lot of really difficult situations with family, and sometimes you would meet them in the corridor and they would be in tears. Everybody has a breaking point, and you would see certain days where that would happen, but they would boost themselves back up and go back in, which I take my hats off to them for doing.
Usually the nurse is the one that spends hours and hours with that patient, and that final moments are quite draining. I know nurses that have gone home crying because of that. I know nurses that have used their own social media to call families for them to see that relative in the last few moments of their life.
I remember one of our nurses did it on his phone with a patient who was nearing the end of their life, with their family who couldn't come in. And the response we had from that, from the family side of things, they were so grateful to be able to see their loved one before they passed away.
We had great community support. We had local restaurants from all around Northamptonshire sending us food. We had companies sending us donations. For example, Weetabix sent us cereals. Other people were sending us bread, vegetables, food boxes, toilet rolls.
So the first donation we had was a lorry from Knights of Old with 2,000 bunches of flowers.
I remember walking out of hospital one day, and there was a huge lorry giving out flowers to everyone. I think it was near Mother's Day, and that was really nice.
So I was here that Easter weekend, I was here with other members of the exec team. And Mark Smith, who's our Chief People Officer, he and I were delivering Easter eggs together, and we were setting up little displays when we delivered them, and it was great to interact with staff. We had something like 14,000 Easter eggs. I mean, it was like I've never seen so much chocolate in my life.
The community were amazing. They made stuff for us. The schools that gave us all of their science goggles, which became reusable eyewear. Anything that we needed, they were willing to help.
Things just snowballed. You know, we had other businesses phone up. We want to donate drinks. We want to donate biscuits.
In all, we prepared 17,080 meals over 8 weeks. We cooked 300 meals a day for Kettering Hospital, 150 vegetarian and 150 meat dishes. We also had some great support from the village and our neighbours. Villagers came and made the boxes up and stuck all the labels on for us, which was fantastic.
We didn't have to think about meal preparation at home. When we knew when we came into work there was a meal for us, you know, and that was such a luxury.
The donations for me and the clap were incredible. The first one genuinely brought me to tears. I was outside of my garden, and just hearing the whole neighbourhood erupt spontaneously was genuinely awe-inspiring, and there was a lot of comments from our Facebook group of just how important it was.
Having that support on a Thursday evening at 8 o'clock was fantastic, because it made the staff feel like the whole nation is living that with them, that they're not alone and that the patients aren't alone.
When you do have really dark shifts and you don't feel very happy, just knowing that there are the public that care, it really does keep you going.
One of the things that really brought a smile and probably a tear to a lot of people's eyes was the rainbow heart that was painted on the road outside the hospital, and it just really symbolised, you know, everything about the NHS that's brilliant.
Everybody just really pulled together. It was amazing to see.
It was like part of a war effort. Everyone wanted to contribute, to be part of it, to absolutely give their best for patients and to support their colleagues as well. Now that we've moved past the first wave of COVID, we are expected to then look at how we reset some of our services, and that really means how we get back to doing routine outpatient appointments, routine elective procedures.
Second peak is a reality in terms of we are expecting it to happen.
So expecting the hospital to be busier than it would do normally in a normal winter period with the complexities of COVID over the top. Just 2 or 3 weeks ago we made a decision to return to birthing partners visiting within the maternity suite, and we were the first hospital in the country to return that, which is something we're quite proud of.
Of course, the fear of the second wave is there, but by the time the real second wave hits, maybe in winter, we may have 1 or 2 more drugs available because of the research which is ongoing at the moment. I think we are in a much more robust position at the moment with regards to the treatments.
The executive team and the trust board have been massively impressed by all the support we've had. We'd like to thank all the staff and our community for everything they've done. Everyone has done a fantastic job. The response has been absolutely amazing, and we've all been really blown away.
Thank you to everybody that helped us within the community.
All I can remember is the fantastic sense of camaraderie that we got from the team, and I remember being absolutely humbled by just the sheer bravery of the people that I work with, and that's the guys and girls who genuinely do their job without a second thought. There was no complaints. They got put into an incredibly difficult situation, dealing with life or death decisions on a daily basis. They come facing a disease that they don't know anything about. They're unsure whether or not they're going to survive themselves if they catch it. They're unsure if they're going to take it home to their family. But they did it without complaining. And more so, I felt humbled just by the way that all of our colleagues from around the hospital dug in and really, really helped out. It's incredible. And I really think that's what's special about KGH, is that we did it as a team and we did it as a community, and we helped provide care for the people who matter, and that's the people out there, the people that we look after.
A big thank you from me and all of the execs in the trust board.